Level 2 Donning and Doffing. This procedure describes the basic steps for donning and doffing of Level 2 personal protective equipment, also referred to as PPE. This type of equipment is to be worn when there is contact with the patient with visible blood and/or bodily fluid from the triage area, walking into the isolation room, when caring for the patient within the isolation room, and when there is low-risk contact with the patient. Another consideration is when the patient's travel history meets the requirements for isolation in the triage area. The following supplies should be gathered prior to putting on PPE. This step is also referred to as donning. The items needed include foot and leg covers, gloves, nitrile, gown, impervious, N95 respirator, goggles, fluid-resistant head and neck cover, face shield, gloves, nitrile. For Level 2 PPE, disposable scrubs may be worn under the PPE. Donning. Prior to donning, you should have a trained observer watch you put on the PPE. A trained observer ensures that you are donning the PPE as outlined by protocol. The trained observer will assist you as needed with donning PPE and making sure no skin or hair is exposed. The observer will utilize a donning checklist to guide you as you put on each PPE. Prior to donning PPE, you should remove your identification badge, wristwatch, bracelets, lab coat, other dangling items, and personal items such as a cellular phone. In short, if there is anything that you have with you that you want to keep, please secure the items elsewhere before donning. At this point, we will begin the donning process. Step 1. Gather your Level 2 equipment and put on paper scrubs. It is highly recommended that you wear deconnable shoes. Put one foot into a leg cover and pull the leg covering up until in position. Repeat this process for putting on the leg cover on the other foot and pull over the leg. The foot and leg cover should be pulled to just below the knee. Step 2. The next step is to put on the inner nitrile glove and extend to cover your wrists. Following the placement of the nitrile gloves, put on the impervious gown that fully covers your torso and fasten in the back of the neck. Tie all gown strings in a bow. Do not use a knot. Have your observer check your ensemble. Step 4. Next, you should put on the N95 respirator as per protocol. Perform a fit test. Check the respirator prior to putting on additional PPE. Step 5. Once the N95 respirator is on, place the goggles over your face and eyes. Adjust the goggles to fit. Observer will then perform a visual inspection. Step 6. Then put on a fluid-resistant head and neck cover. Pull the end of the head and neck cover so the fluid-resistant flaps lays flat against your back and chest. Observer will perform a visual inspection. Step 7. Next, put on the face shield. This should be placed over your face and eyes. Adjust the face shield to fit. Observer will then perform a visual inspection. Step 8. It is now time to put on the last piece of PPE, the outer nitrile gloves. The gloves should extend to cover your wrists and over the isolation gown. Step 9. The last step is to have the observer check your ensemble to ensure there is no skin or personal garments exposed. When a mirror is available, assess the donned PPE ensemble for correctness. Please use the Level 2 checklist. We have now completed the donning process for Level 2.